There's controversy tonight over what to believe from the CDC. The agency has changed COVID guidelines several times during the pandemic. In the beginning, the CDC said it wasn't necessary to wear masks, but of course that guideline changed back in April. Last month, the CDC said if you aren't showing symptoms, you don't have to be tested, even if you come into contact with someone who's infected. Well, that was done under pressure from the White House, but that too changed to go back to recommending everyone get tested after a possible exposure. And now the latest controversy coming out today. The CDC's website said COVID can be transmitted through airborne particles, but then the CDC suddenly took that information down. This back and forth has been confusing for the public and pretty frustrating for doctors. Brianna Whitney has this story.
For decades, doctors have trusted the CDC for guidance on how to treat their patients. But this Arizona doctor says they've made several big mistakes during the pandemic, and he's now telling his patients to check several other sources for reliable information too.
This is the notice you'll now see on the CDC website, just days after saying coronavirus transmission is airborne through particles like aerosols. The CDC then took that guidance down Monday morning, claiming it was posted in error and they're reviewing their recommendations.
How could a big organization like that just post something on a website by accident? I don't know who's allowed to do that. It just doesn't seem like a valid excuse.
Valley emergency medicine doctor Frank Lavecchio says this is not only confusing, but says for months data has backed up airborne transmission beyond just coughing or sneezing.
I'm not quite sure what is happening with this airborne situation. We can say clearly it is airborne. Unfortunately, it hurts the public, it hurts their credibility, and it hurts physicians reviewing this sort of data.
Saying people who were exposed to COVID but didn't have symptoms did not need to be tested.
We thought that was outrageous. All physician colleagues were on text strings, emails, etc. We said, this is crazy. I think they made a mistake.
The CDC recently walked that back to suggest those without symptoms who have been exposed still need a test. Dr. Lavecchio says for his patients and the public, they need to be cautious when reading the CDC website.
Do you rely on that 100%? Absolutely not. Okay. Do you question everything you read and try to get other sources? Yes, you should.
So where else can you go for trustworthy information? Dr. Lavecchio suggests sites like the Mayo Clinic and Johns Hopkins University, as well as looking at the actual studies organizations are doing during the pandemic. Reporting in Phoenix tonight, Brianna Whitney for Arizona's Family.